Hello students, welcome again to our physiology. Today we are continuing with our medical lecture series and we are going to have a very long discussion of endocrine system, and to start we will have introduction to endocrine physiology. My name is Dr. Machera. Just to remind you, don't forget to subscribe and put a notification on so that you can be updated with the new upcoming lectures. Our learning objective in this topic, today we are going to describe the endocrine system at the part of introduction. Second, we have to explain the classification of endocrine hormone, and we'll have to describe the importance of endocrine system. And our last objective will be about how the hormone production is being regulated. So you are only welcome to this introduction to endocrine system. I beg you to pay attention so that at the end you can have a fundamental knowledge which will be used in medical practice. To start, as usual, I would like to present a case scenario to you on which the knowledge of endocrine system is very important to understand what is the underlying pathology in this patient. Our case scenario is about a 32 years old female who discovered herself after taking a physical examination that she has hypertension and hyperglycemia. She was ordered to take an oral glucose tolerance test, which was found to be normal. The blood test revealed normal blood level of T4 and T3. These are tetraiodothyronine and tetraiodothyronine hormone produced by the thyroid gland. We should discuss them in detail. But a more extensive testing showed that her blood cortisol level abnormally high. The patient was also ordered to do a blood cortisol level, and the result was found to be elevated. Rosemary has a generalized puffiness but no myxedema. Upon questioning, she states that she does not have a history of chronic inflammation and has not been taking any immunosuppressant drug. Of course, this history is very important because some immunosuppressant drug may mimic the presentation. A later assay of her blood adrenocorticotropic level revealed that they are only about 1/50 of the normal. So the question is, what might account for Rosemary's symptoms? To answer this question, I would like you to pay attention in this very discussion of endocrine physiology so that as we are proceeding, we'll have the fundamental understanding of what is going on in this patient. To start, students, I would like to define the endocrine system before proceeding. Because we are discussing introduction to endocrine system, it is very important to understand the definition of endocrine system. By definition, we say endocrine system, this is a system of organs which are known as glands, and these organs are specialized to secrete chemical substance known as hormone. As far as this section is concerned, the glands we are discussing here are endocrine glands. By so saying, it's very important also to mention that the glands can be classified into two groups depending on the modalities through which they secrete their product. We have the endocrine glands. These are ductlets. Sometimes these are ductless glands. They produce their chemical substance directly into the bloodstream, where they travel up to their target organ and mediate their effect. The second part are exocrine glands. These are duct glands. They have duct. They secrete their chemical substance into the duct, and the substance travel through that duct up to their target organ, where it mediates their effect. The classical example I can use here to differentiate between endocrine and exocrine is to use the pancreas. Do you remember the pancreas? This is an organ found in the posterior aspect of the stomach. The pancreas has both exocrine and endocrine property. The largest part of the pancreas is the exocrine part, where the pancreas produces pancreatic juice, which travel through the pancreatic duct up to the duodenum and mediate its effect, which is digestion of food substance. And the rest of the pancreas, which is the small part, this is endocrine, which produce the hormone, insulin, and the glucagon. These hormones are very important in homeostasis or balance of blood glucose. They are produced direct into the bloodstream, and they travel through the blood up to their target organ, where they mediate their effect. So to summarize, when we say endocrine, we mean ductless glands, where the chemical substance produced the chemical substance are produced directly into the blood, and the exocrine are duct glands, where the chemical substance are produced into the duct. The endocrine glands are distributed throughout the body, and the hormone produced also have different effect in different parts of the body. The hormone produced by endocrine glands act in a different fashion. We can say it has 3 different fashion on which it acts. Number 1, the hormone produced by the gland can act on the gland itself. That is the autocrine fashion. And number 2 is where the hormone produced by a gland act in a nearby structure, that is paracrine. And the last is when the glands produced, the hormone produced by the gland act in a distant organ. For example, we have the pituitary gland in the brain. It produces so many hormones, just to mention adrenocorticotrophin hormone, which has effect on the adrenal gland. I'm sure you remember from your anatomy, the adrenal gland is found in the superior aspect of the kidney. So you can imagine the distance from the brain up to the kidney. That is a very far distance. So the hormone can have effect on a very far distant organ. Also, another thing to mention is the master gland. By definition, we say a master gland, this is a gland which controls other glands to secrete their hormone. And there is a controversial here I would like to make clear. Sometimes the pituitary gland was used to be called the master gland, but in a real sense the pituitary gland is not the master gland. By just saying that any gland which control other gland to secrete their hormone is the master gland, the pituitary gland can fit to be the master gland. Why? Because the pituitary gland control many glands to secrete their product, for example, the thyroid, adrenal gland, and the others. But also the hypothalamus control the pituitary gland to secrete their product. So both hypothalamus and the pituitary, by using that simple definition, they can just meet the criteria of being the master gland. But why do we say the pituitary is not the master gland and the hypothalamus is the master gland? That is, there is another secondary property for a gland to be a master gland. For a gland to be a master gland, the second property is it should not be under control of any glands to secrete its chemical substance. As we have seen, the pituitary control many other glands to produce their hormone, but the hypothalamus controls the pituitary. So the pituitary cannot be a master gland, because though it controls other glands to secrete the hormone, but it has allowed the hypothalamus to control it. But the hypothalamus, which controls the pituitary gland to secrete its hormone, is not under control of any other gland. That's why we say the hypothalamus is the master gland and not the pituitary. To summarize, when we say a master gland, it should have 2 properties. Number 1, it should control other glands to produce their chemical substance, and number 2, it should not be under control of any other gland. So the hypothalamus is not under control of any glands, and it controls the pituitary. The pituitary, which control many other glands to secrete their product, is controlled by the hypothalamus. That's why it's not the master gland. Thank you. We can proceed. I'm sure I tried as much to make that point clear. The major endocrine glands in the body which we have, I would like just to mention them. We have the hypothalamus. Of course, we shall discuss it in detail as we are proceeding. We have the pituitary gland. Don't forget, hypothalamus is our master gland and not the pituitary gland. We have the thyroid gland found in the anterior aspect of the neck. We shall discuss it in detail when we will be discussing hormone of the thyroid gland. We have the parathyroid gland. They are glands found in the medial aspect of the posterior part of the thyroid gland. we shall discuss them together with the thyroid gland. We have the adrenal gland, as I said before. They are found on the superior aspect of the kidney. Sometimes we call them suprarenal glands. We have the pancreatic islets. Of course, the pancreatic islets is to insist on the endocrine part of the pancreas, because the pancreas has exocrine as well as endocrine, and here we are discussing endocrine part. That's why we are being specific that it is the pancreatic islets which are endocrine, which we are going to discuss here. We have also the ovary and the testes. These are very important organs as far as the reproduction is concerned, and we shall discuss them in detail as we are proceeding. Apart from endocrine organs which secrete hormone, as we have discussed, we have also other organs which perform many other functions, but in addition they produce hormones. These organs, to insist, are not called endocrine gland because they are not specialized for hormone production only. To insist, the endocrine organ are specialized to produce hormone only, but not performing any other function. Example of these organs are like the heart. We have the liver. Of course, the liver performs many other functions, but in addition, it produces thrombopoietin hormone. This hormone is responsible for production of platelets. We have the kidney producing erythropoietin hormone, very important in stimulating the bone marrow to produce RBC. We have also the adipose tissue. These are just examples of the organs which perform many other functions, but in addition they produce hormone. Again, to insist, they are not endocrine glands. Endocrine glands are only specialized to produce hormone. Okay, student, after defining what is the endocrine system and the other important definitions, let us have another look of what is the hormone. So I would like to define the hormone as a regulatory molecule secreted by the glands which has a different effect in the body system. So hormone affect metabolism of their target organ. By doing this, they help to regulate body metabolism such as growth and reproduction. The effect of specific hormone on the body will be discussed in detail in their respective glands. Some specialized in neuron, they secrete their product in the bloodstream rather than into the narrow synaptic cleft. Just to remind you, neurons do communicate by secreting chemical substance known as neurotransmitter into the synaptic cleft. So we have some few specialized neurons which do not secrete their neurotransmitters into the synaptic cleft, but they rather secrete their neurotransmitters into the bloodstream. And these neurotransmitters, because they are secreted into the bloodstream and not in the synaptic cleft, they are known as neurohormone. Of course, to insist, neuro because they are secreted by nerves or neuron, and the hormone because they are secreted into the bloodstream. In addition, a number of chemicals such as epinephrine and norepinephrine are secreted both as a neurotransmitter and as a hormone. So sometimes there is a sharp clear distinction between the nervous system and the endocrine system. Again, to insist, nervous system and endocrine system, these are systems which are very important to make sure that different parts of the body they do communicate. That's why it is very difficult to have a clear distinction between the nervous system and the endocrine system. These are systems which work by cooperating each other in a very close way. So students, after defining the hormone, it's now time to classify the hormone. These hormone, which are chemical substances produced by the glands, they are classified into different types based on the modalities used to classify them. Now, these are modalities used to classify the hormone produced by our glands. We can classify the hormone based on chemical structure. We can also classify the hormone based on their target cell. We can also classify the hormone based on their water solubility, and we can also classify the hormone based on the nature of which they are secreted. So we shall start discussing the classification of hormone by using an individual criteria. To start with the chemical structure, I would like to say, based on chemical structure, hormones are classified into 4 groups. We have the amine hormone, we have the polypeptide hormone, we have the glycoprotein hormone, and last we have the steroid hormone. This is the classification of hormone based on their chemical structure. Based on the amine category hormone, these are hormones which have amino acid, tyrosine, and tryptophan. Of course, they include the hormones secreted by the adrenomedulla, the thyroid gland, and the pineal gland. We shall discuss them in detail as we are proceeding. Another types or classification of hormone is polypeptide and protein. Polypeptide and protein, these are hormones which contain amino acid. The only difference between polypeptide and protein is that the polypeptide, these are hormones which have less than 100 amino acid, while the protein, these are hormones having more than 100 amino acid. But we have some exception in which we have two peptide. For example, in insulin, these hormones are not called polypeptide, but instead they are called dipeptide because they have only 2 peptide chain. Another classification is glycoprotein. Of course, the glyco from glycogen and the protein. These are hormones which are having carbohydrate and the protein in their structure. This hormone, to mention example, is follicle stimulating hormone and luteinizing hormone. These are productive hormone. We shall discuss them in detail when we will be discussing the productive hormone. And the last is the steroid. These are hormones which are derived from cholesterol. Just to mention example is testosterone, progesterone, estradiol, and cortisol. Okay, another criteria used to classify hormone is based on their target, on their effect on their target cell. Based on the effect in their target cell, hormone can be classified as a tropic hormone. Tropic means feed. These hormones, they are not food, but what it just means is that when they act on their target organ, they lead to hypertrophy or increase in size of that particular organ. And to insist, these are hormones which are produced only by the anterior pituitary gland. There is no any other gland producing hormone which are tropic in nature. Only the anterior pituitary produces hormone which are tropic in nature. These hormone produced by anterior pituitary, there are so many. Just to mention, we have the thyroid stimulating hormone, we have the luteinizing hormone, we have the follicle stimulating hormone, and we have the adrenocorticotrophin hormone. We shall discuss this hormone in detail when we will be discussing the pituitary gland. Now it's just introduction to endocrine system, so we are just mentioning. Another category based on effect, we have anabolic hormone. Anabolic hormone, these are hormone which stimulate anabolism in their target cell. And of course, anabolism, this is a set of metabolic pathway that construct or make up larger molecule from smaller molecule. This reaction require energy. Example of anabolic process include the growth and the mineralization of bone and an increase in muscle mass. So we have the hormone which are anabolic. Just to mention the example of anabolic hormone, these are steroid hormone, growth hormone, we have the insulin and the estradiol. Sex hormone, these are hormones that target reproductive tissues. Types in many contexts, the two main classes of steroid are androgen and estrogen, of which the most important human derivative are testosterone and estradiol respectively. The sex steroid, they include androgen such as testosterone, estrogen such as estradiol, progesterone, such as progesterone. Of course, we shall discuss in detail this hormone as we are proceeding. Classification based on their water solubility. This is another criteria used to classify hormone. In terms of these criteria, hormone are classified based on their water solubility, whether they are water soluble, we call them polar, or water insoluble, we call them non-polar. Of course, hormone which are water soluble, meaning they are lipid insoluble. This hormone cannot pass through the cell membrane. Do you remember the cell membrane is lipid bilayer? So any chemical substance which can cross the lipid bilayer must be lipid soluble. There's a hormone which are water soluble or polar, they are lipid insoluble, and therefore they cannot enter into the cell. They mediate their effect through extracellular receptor which are embedded on the cell membrane. Another category of hormone, the hormone which are water insoluble or non-polar. When we say water insoluble, we mean lipid soluble. The hormone which are lipid soluble can pass through the lipid bilayer membrane of the cell membrane. So when they are able to pass through the cell, they can mediate their effect intracellularly within the receptors embedded within the intracellular aspect of the cell, such as in the nucleus. So to insist, lipid soluble hormone, they mediate their effect intracellularly, while the lipid insoluble or water soluble, they mediate their effect extracellularly. When we say lipid soluble, we mean lipid loving, that is lipophilic, and when we say lipid insoluble, we mean lipophobic. Based on the nature of the hormone secreted, this is another criteria used to classify hormone. Based on this criteria, we can say the hormone are classified into two groups. We have the hormone classified in active form, and we have the hormone classified in inactive form. The hormone classified in active form, these are hormones which are able to function directly soon after being secreted, and those which are produced in inactive form, they cannot function until further metabolized or broken down by their target cell into their active form. That's where this hormone can mediate their effect. These hormones which are inactive in nature, they are prohormone and pre-hormone. Prohormone and pre-hormone, these are molecules that affect the metabolism of their target cell after being metabolized or broken further from their parent chain into their active molecule. In case of polypeptide hormone, the precursor may be a very long chain. That's a prehormone that need to be broken down into prohormone, and then from prohormone to active hormone. A classical example is insulin, which is produced in inactive form, which is proinsulin. Okay, after having finished to classify hormone based on their different criteria, it's now time to look mechanism of hormone release. Hormone release is under three mechanisms. We have the humoral mechanism, and we have the neural, and we have the hormonal mechanism. In humoral mechanism, this is when the hormone are produced in response to change in ion concentration within the blood. For example, the blood glucose and the insulin. When the blood glucose is high, the insulin is secreted from the beta cell of the pancreatic islets, and when the glucose is low, the glucagon is produced from the alpha cell of pancreatic islets. This is just to insist that the humoral mechanism is where hormones are secreted based on changes in the ion concentration of nutrients circulating within the blood. In neural mechanism, this is when the hormone are secreted after nerve stimulation. Classical example to explain this is when the baby is lactating. When the baby is lactating, the stimulation of the nipples send impulse to the hypothalamus, where the hypothalamus lead to release of oxytocin from the posterior pituitary. And also during childbirth, when the uterus contracts and push the baby against the cervix stretch, and the stretch receptor send impulse to the hypothalamus, and again the hypothalamus commands the pituitary gland to secrete the oxytocin, which increase contraction of the uterus. This is when we see that hormones are produced after navel stimulation. Hormonal stimulation, this is the very big part, or this is the major part of hormonal secretion, where the hormones are secreted under hormone stimulation. Many of the hormones secreted by peripheral glands are under hormonal control. These are hormones which are under control of the anterior pituitary, the thyroid, to mention the adrenal gland. We have also the reproductive organs. These organs produce hormone after being stimulated by the hormone from the anterior pituitary. So just to insist, we have the humoral due to change in ion concentration, we have neural due to nerve stimulation, we have hormonal due to hormonal stimulation. Okay, after discussing mechanism through which hormone is being secreted, it's now time to have a look on how we regulate the hormonal secretion from glands. Generally, we say regulating hormone means controlling how much of hormone is secreted and made by the cell. So we have three different mechanisms through which we can regulate hormonal secretion. We have the negative feedback. In the negative feedback, this is when an organ which the gland receive command to produce a hormone, and once the hormone is produced, this hormone lead to cancellation of the command. That's the negative feedback. For example, the anterior pituitary, which produces thyroid stimulating hormone, once the thyroid stimulating hormone is produced, it will go and stimulate the thyroid gland to produce the thyroid hormone. Once the thyroid hormone is secreted, they will inhibit the pituitary from secreting the thyroid stimulating hormone and result in cancellation of its production. This is the negative feedback. You produce something, once that something is produced, it leads to cancellation of its production. That is a negative feedback. Okay, we have another modality, that is the counter-regulatory hormone. Of course, the counter-regulatory hormone, this is different from negative feedback as well as positive feedback. This is where two hormones acting in antagonistic fashion. One hormone once it is produced lead to an effect, and when we want to cancel the effect, we need other hormone apart from the first hormone, which will cancel the effect of the first hormone. The classical example is how glucose is being balanced in the blood by insulin and glucagon. When the blood glucose is high, insulin will be secreted from the beta cell of islets of Langerhans, and the insulin will stimulate the peripheral cells to pick up glucose, and the level of glucose in the blood will go down. Once the level of glucose in the blood is down, then the glucagon will be secreted again by alpha cell to increase the production of glucose into the blood. That is to take the cell to put glucose into the blood rather than taking it from the blood. Of course, some few exceptions, such as glucose, where we need a very tight control. That's where we can have counter-regulatory hormone to ensure that we achieve a tight control of glucose within the blood. Okay, let us have a look on the last modalities of hormonal regulation. That is the positive feedback. For positive feedback, the opposite of negative feedback. Do you remember what we said in negative feedback? the gland is stimulated to produce a hormone. Once that hormone is produced, it leads to inhibition of its production or cancellation of its production. But in positive feedback, the hormone is produced, and once that hormone is produced, it leads to enhance its production. The classical example to explain this is to use the oxytocin hormone. Oxytocin hormone, we shall see it in detail, is produced by the posterior hypothalamus. This hormone is very important during childbirth and lactation. During childbirth, the uterus contracting under oxytocin stimulation and push the baby down against the cervix, leading to stretching of the cervix. Stretching of the cervix send nerve impulse to the hypothalamus, which through the pituitary gland release more oxytocin. The released oxytocin causes more uterine contraction and further pushing of the baby to the cervix, and more stretching of the cervix, and more nerve impulse sending to the hypothalamus, and more oxytocin release. This will continue until the baby is pushed out. Also during lactation, when the baby is sucking milk, the nipple is being stimulated and the nerve impulse are sent to the hypothalamus, and via the pituitary gland the oxytocin is being secreted, which causes milk ejection. Of course, you should remember the function of oxytocin is milk ejection. We shall discuss this in detail. Again, just to insist, positive feedback is very rare. Most of the hormone is under negative feedback control and counter regulatory. We have only a few exceptions when we have positive feedback, like what I said in oxytocin during childbirth and during lactation. Generally, the effect of positive feedback mechanism is amplification of the stimulus, while the effect of negative feedback is the cancellation of the stimuli. That's the only difference. In positive feedback, we have amplification of the stimulus until the event is achieved, while in negative feedback, there is a cancellation of the stimulus, which lead to underproduction or ceasing to produce the particular hormone. The last part of our discussion is to look at the importance and the function of the endocrine system. The endocrine system is very important in mediating many effects in the body, such as stimulating growth or inhibiting growth. We have mood swings, it controls the mood. We have induction or suppression of apoptosis. This is a programmed cell death. We also have activation or inhibition of the immune system. We also have regulation of body metabolism, particularly the thyroid, we shall discuss in detail. Prepare the body for mating, fighting, fleeing, and other activity. Also, preparation of the body for new phase of life, such as puberty. These are the function of reproductive hormones. We have controlled reproductive cycle and then hunger, craving. Of course, this function of the endocrine system, we shall see them as we are proceeding in discussion of individual hormone and individual gland as we are going on with our discussion. So to end up, it's better to have a test of ourselves to see what we have, to see whether we have captured a knowledge which was intended in this discussion. Number one, compare the 4 chemical classes of hormone with reference to hormone within each other. Here is to classify the hormone based on their chemical structure. Do you remember we had the amine, example of the thyroid hormone? Do you remember? We have the glycoprotein. Do you remember? This is a hormone having carbohydrate and protein. Examples. Do you remember the growth hormone? Another was a polypeptide and a protein, such as insulin. And the last we had the steroid. Do you remember? Such as testosterone. Of course, number 2, define prohormone and the prehormone. If we remember, when we were classifying hormone based on their nature of production, we said the hormone can be produced in active and in inactive form. In inactive form, we said we have the prohormone and the pre-prohormone. Prohormone, there's a hormone which they are produced in inactive form and they need further broken down by their target cell to become active. And we say this sometimes the pre-prohormone can be a very long chain, which is the pre-prohormone, which need to be broken down from pre-prohormone to prohormone and from prohormone to active hormone. Describe the common characteristic of hormone and the neurotransmitter. Of course, this is very simple. We shall just review it as we have discussed it. List the terms used to describe hormone interaction and give example of this hormone. Explain how the response of the body to a given hormone can be affected by concentration of that hormone in the blood. Of course, that is how the hormone are produced under humoral mechanism. Do you remember? Yes, I put a pause just to insist and to give you the time to remember. Okay, thank you for listening. This is the end of our discussion in Introduction to Physiology. Don't forget to subscribe and put a notification on so that to be updated with the upcoming lectures. I wish you the best.